Hey, everybody, welcome. I'm Dr. Darrell Wolfe, and welcome to Real People, Real Healing. Now, what I'm going to be doing is I'm starting this series, and what's going to happen is let's say that you decide that you would like to do a consultation with me. Now, if you'd like to do a consultation with me, you can text me to 469-861-9454. Okay. And what I'll do is I will call you back. All right. Now I'm going to be picking people that would like to call and have a consult with me. Okay. And the consult, you don't have to show your face at all. Okay. I've got somebody on here. Her name is Angie. You're not going to know where she lives, who she really is, but she's going to be coming on and talking about her concerns on an emotional, physical, nutritional level. Okay. And we're going to be doing a consultation. That consultation is going to go into my library, and it's going to go into a guide called Real People, Real Healing Guide. And we're going to start collecting from A to Z real people, real consultations, so that people can go into my Real People, Real Healing Guide in my library and go, well, I've got eczema, I've got stage 3 lung cancer, I've got whatever the case may be, and you'll be able to access this. Now, it's going to take time to build it up. I'm going to do maybe, honestly, I'm going to try to see if I can do 4 or 5 a week, okay, and start building this up so that people can access this. And then you can get a consultation if you decide that you think we know what we're talking about from one of my master consultants. You can go to docofdetox.com and click on consultations and then pick the person you want, and you get lifetime support. Okay. You'll be with that master consultant for at least 6 weeks. We make that guarantee. Some people get married, some people move, they move on. But the reality is you'll be able to call us for no more than $150 lifetime support. Because understand something, health is a language. It's not like a 1-hour consultation and you go home with $2,000 of product and hope that everything's just going to work out okay. And the other thing is this, how psycho are we to go and lay down on a couch or go talk to a therapist for an hour every week? Let me tell you something. Until you're going to go in and change your personality, you're never going to change your reality. Until you know what a perfect day looks like from the moment you rise until you close your eyes, you're never going to have it good. Oh, you'll have times when you're happy. You'll have times when you feel loved, but you're never going to be on a consistent. Understand something. You know what? How many people are their true authentic selves? Well, how about hardly anybody? How about 1 out of 10,000? And you may not believe that, but you're comparing yourself to the rest of the herd. You know, a lot of people say, oh, I've got a great diet. Yeah, compared to people who are killing themselves. Oh, my bowel movements are great. How many people do you poop with? Oh, my family, we are so loving. Really? How many other families are, what kind of comparison do you really have? The reality is we live in these little boxes. And tomorrow I'm going to be doing a 1-a-day. And that 1-a-day is going to be called Cycles, not Psychos. Cycles, not Psychos. Understand something, and you better get this, okay? The world revolves around cycles. Like if you got a perfect day and you repeated it, then that means that you're not going to go psycho. You're going to have cycles of love. Do you understand? You need to get this. The psychos know that the whole world revolves around cycles. Now, I'm going to say something, and then we're going to bring Angie on. We're going to do a consult. But you need to get this, okay? Oh, you're not going to like this, because Canada, where I am right now, is the pimple on the dog's butt. Now, I'm not trying to call Canada a pimple, but I'm sure that a lot of people in Canada think it's a pimple because they'd like to pop it right now because of who's running the country, right? Or running the country into the ground. But the reality is Canada is the pimple on the dog's butt, and the dog would be United States. And whether you like it or not, I'm going to prove tomorrow that I'm not going to prove it. We're going to talk about it, and it's not tomorrow. It'll be on Monday at 9 o'clock Eastern Standard Time. I'm going to have Peter Temple on, and he is a historian, and he goes back and he takes a look at psychos, and he has gone back tens of thousands of years, and he's going to prove to you that United States was the empire country for the last 500 years, and in the next 50 to 75 years, the dollar will be gone. Okay, it will be gone, whether we like it or not. And United States will no longer be the empire country of the world. There will be a new one. But guys, don't get you're in a knot, because I lived in Mexico, which is like a third world, supposedly a third world country. And understand something, I've never been so happy. I was there for a year and a half. You know, if you want to go someplace and really live somewhere beautiful, truly Mexico is really beautiful. Nothing would need to change for me, so call it a third world country, but I had a first world life. And the reality is this, everything is an illusion that they give us. So you're either going to understand that everything is cycles, like what? Seasons, right? We got 4 seasons. Whether you like it or not, you can't wear your shorts in the wintertime when it's snowing and ice out. Well, you could, but it might be a little difficult. Okay, there's cycles, like, you know, 8 hours of the day, we've got a digestive period. Then we've got our assimilation of our nutrients. And then we've got our elimination of our waste. If you follow these cycles, you have a good chance you'll be well. There's cycles in real estate. Every kind of 18 to 22 years, real estate goes up and down. So it's a time to buy, a time to sell. You know, the financial market, it has cycles too. The tides, they go in and they go out. There's circadian rhythm. You know what? If you go on your phones and you don't wear blue light glasses, not blue light, but Tesla glasses are the only healing glasses in the world. And if you go on your phones at nighttime, then you throw your circadian rhythm off. Do you understand? It's all about cycles. But guess what? 99.9% of the population run their life by psychos. They let the psychos run their life. And I got to tell you something, guys. You know what? I don't know. Why are you so scared? Why are you so scared of the government? Why are you so scared of the police? Why are you so scared of the armed forces? Well, what are you scared of? The boogeyman? I mean, you know, seriously? You know, we're just so scared, aren't we? You know, the reality is guess what? These bullies can bugger off. And you know what? Stop being scared and join me, okay? And at 9 o'clock Eastern Standard Time, get ready, because I'm going to have Peter coming on regularly, because, and I hope you're ready for this. We're going to be talking about nutrition, food. We're going to be talking about economics. We're going to be talking about the healthcare system. We're going to be talking about government. He says there are so many changes coming. So you better hold on to your seat. And if you better also pull up a seat, and you better tell whoever you want to, because you are really, truly going to enjoy this show. Also, just know this, that 3 o'clock Eastern Standard Time on Mondays as well, I'll be on here with Jim Gale, okay, for Food Forest Abundance. And we're going to be coming on at 3 o'clock Eastern Standard Time every Monday for about 15 minutes. And we're going to give you an update on what Jim Gale's doing to help to feed the world, to help to train the world how to feed itself. That would be better, wouldn't it? Okay. All right. So let's get right to it. I'm going to be bringing Angie on. I'm going to give her a call right now, and she's going to come on and we're going to do a consultation. Now, are you ready? Because this is where the best learning is when we actually do a real life consultation on, because guess what? You know that we all have something related in each other. You'll see, we're talking to Angie and you're going to go, oh yeah, I feel just like she does. Or yeah, I did that too. And I got the same reaction. Hi, Angie.
Hey, Doc.
How you doing?
I'm great. Thank you. How are you?
I'm great. Okay. So let's get right to it. Okay.
Okay.
Angie, how old are you?
41.
41 years old. And how much do you weigh?
118.
118. And what's your height?
5'3".
5'3". Okay.
Mm-hmm.
So let me see. 5'3", 118. Pretty good. You could lose a couple of pounds, but yes. The reality is you're pretty good. You're pretty good. And the reality is that people would think that I'm skinny, but I'm not. Okay. For my age, I actually could lose another probably 4 or 5 pounds and of what? Of fat, but gain more muscle and tone. See, the reality is that how much? How old did you say you were?
41.
So 41. So right now, Angie's starting to lose muscle. So that's what's happening. So as you get older, you gain fat, you gain cellulite, you gain scar tissue, okay, and you lose muscle. So that's when you have to bring your game up. So the older you are, the more you need to eat live foods because you're getting closer to the end. Do you get that, Angie?
Yes.
So we need to eat more foods that have light and high frequency in them, cleaner, purer, higher vibrational, because every cell in your body is a battery. So the reality is, guess what? The majority of the population never change their diet. They don't change anything. You know, like 99.9% of the population eats crap. That's it. Puts crap in their yap and that's it. But everybody thinks they eat a really great diet. Right, Angie? Doesn't your family believe it eats a really great diet no matter who you talk to?
For the most part, yeah.
Oh yeah. Oh yeah, they do. They do. And you know, when you talk to people about their diet, they're always going to lie to you too. People always lie. And it's not because they're liars, it's because their subconscious wants to protect the dominant prominent beliefs and all the addictions that come along with it as well. So Angie, when was the first time you called or got in touch with me? How long ago was that?
I've been doing this for about 3 weeks now.
3 weeks.
Yeah.
Okay. So what happened? So back then, let's go back to 3 weeks when you called.
Okay.
And why did you call?
Okay. I was just experiencing detox symptoms. I wasn't sure if something was too much of something or how to take something. And I originally started this endeavor for scar tissue and inflammation. And I ended up passing 2 parasites, and I had no clue I had parasites.
Oh, let's not jump into the parasites yet. But okay. Let's talk about you used a device to try to get rid of scar tissue. How did that work?
Oh, God. I don't know if you guys have heard of Ashley Black and the fascia blaster, but she swears up and down that you open up your fascia, you lose cellulite, you get skinnier. I mean, it worked. It opened things up. But when I stopped using it, I became adhered. My fascia was adhered to my muscle, to my bones. I didn't have full range of motion.
Well, because guess what? You didn't open up the fibers. You tore them apart.
Yeah, I ripped it off.
Okay, yeah, so we have a technique called Wolfe non-surgical that I can reduce a fibroid tumor the size of an orange by 20% minimum in 20 to 30 minutes. And I'm not tearing anything apart. I'm lovingly pulling the fibers apart. But this fibroblaster, I know that over the years, there's been tons of damage done, and it's going to continue. Because the reality is people are actually tearing them. They're micro tearing their tissues. Okay, Angie?
Yes.
Yeah.
Oh, I completely agree. And she would say the bigger the bruise, the better. It was called Beyond Bound. I mean, I was black and blue. I had people stop me in the grocery store. I didn't even know me that saw bruises on my arms asking me if things were okay at home. And I thought I was doing a good thing for myself. So I've been working through that. I've had a history of toxic relationships.
But can I say something? Just know this, everyone. You can come to us for non-surgical, and you might have bruising because, believe it or not, what you were doing, Angie, is you were micro tearing, and that was releasing the toxicity to come to the surface of the body. But if you're micro tearing when you're pulling the fibers apart, the bruising is going to be worse. But understand, everyone, that healthy people don't bruise. If we were to work on you with Wolfe non-surgical and you bruise, that means that you have contaminated tissue. That means you've got issues in your tissues, junk in your joints, because if you can't address emotional problems, or if you don't know how to eat, if you can't address it, you suppress it. And Angie, would you say that in your earlier relationships emotionally with your significant others, would you say that there was a lot of times that you could not address emotional feelings, so you suppressed them?
Absolutely, 100%.
So why don't we talk about that part first?
Okay.
Yeah. So how's your romantic life been? Has it been up and down and all around like everybody else?
Yeah, I mean, I learned about childhood trauma and patterns and attachment styles and all that within the past year, and I've been healing from that. My father is emotionally unavailable. His dad was emotionally unavailable, so that's kind of been my pattern, is to subconsciously choose those guys that are just like my dad, thinking that I, got like a fairy tale, when in all reality, I just want to be loved, but I never loved myself. I just found
Well,
myself.
in reality, no, you can't fix your dad, but you're trying to pick your dad so that maybe you can fix your dad, so that you can fix your relationship. And understand something, you can't fix something that's not broken. You know, what people don't get is you don't have a broken relationship with your father. You have a relationship with your father, and it's not, and it usually doesn't get better. We're lucky if it does and that person opens up or softens up somewhat. But the reality is there's nothing broken about your relationship. It's like people say, the medical system is broken. No, it's not. It's doing exactly what it's supposed to do. I mean, that, they deal in petroleum products that are called medication. They do radiation, chemo, and surgery. So that all came out of Nazi Germany. So the reality is, what part is that is broken? There's nothing broken. So when people say, I have a broken relationship with my mother or my father, no, you don't. If a person's not willing to change their beliefs, if a person is not willing to learn how to love themselves, how could they love their daughter? How could they love their son? How can that even happen? That's not going to happen. And then, you know what? It's always going to be rocky, because the relationship is first dysfunctional with themselves. So why do you think you should have a functional one with them? Why?
Yeah, they don't know how to love properly. That's the thing. But I mean, it took me 40 years to realize the way people treat you is a reflection of how they feel about themselves.
That's right. It's nothing. You're not supposed to take it personal.
Yeah, but I did. I did for 40 years.
And so does everyone else.
Never been married, thank God, because every person I dated was narcissistic. It was toxic. It was up. It was down. It was a push. It was a pull. And then when I got out of it, I felt boring, because that was my dopamine hit, was talking about, oh my God, can you believe what he did?
Whoa. It wasn't your dopamine hit. It was your adrenaline hit. If it was a dopamine hit, it would have been true love. And believe it or not, did you know the only person that can do a dopamine hit is yourself? So even when you were going out with someone and all of a sudden you got this dopamine rush, this beautiful rush through your body, just understand the rush was actually their frequency triggered the love that you have for yourself, because you can't give another person love. It's not like I can hand over love to you. I can have a frequency that will trigger the love you have for yourself inside you.
Right.
Okay.
I worded it wrong, but yeah, there was.
No, you didn't word it wrong. I just want to be more clear about it. That's all.
Gotcha.
Yeah.
Yeah, that was my normal, right? And now it's different. And I'm, at the point where I'm like, I love myself regardless of whether I have to be okay with being by myself. And I can't pour from an empty cup, and my cup's been empty my whole life. So I'm filling my own cup. I'm spending time with myself. I'm spending time with the Lord. I'm saying my Braveheart oath, regardless of if I feel swollen in the tissues or not. I'm feeling some things from taking this, but I just keep saying to myself, my body's healing. It's in the process. I'm loving the journey, and I can't wait for a couple months from now to see the end result.
Well, if you don't rewrite the story and become the hero of the story instead of making it into a horror drama, then it's never going to change. So let's talk about the things that are going on with you, why you decided to come to us, and why you decided to create a protocol. Okay?
Okay.
All right.
Well, let's see. It started out with, I was like probably early, like, I don't know, probably like 13 or 14. I started to have really bad constipation issues.
Right.
And when probably like...
okay, but can I say something, Angie? And I don't mean to break in everybody to try to stop her, but I just want to try to make this a learning thing. So at 13 or 14, she wasn't going at all. That's not constipation. That's called impaction.
Yeah.
Now, if you want to really know it, there's not a child that doesn't have constipation.
I didn't know. I didn't realize I was in a bathing suit. My mom took a picture of me. I looked pregnant. Everything was skinny. My arms was skinny. My legs and my stomach just was like a Buddha belly. But it makes sense. I mean, I love my dad. I love him to pieces. He is who he is, but he kind of bullied me as a child. When I would eat, he would say things like, "You're eating again. Oh, you're going to get fat." So I kind of got like an issue with food, like a
yeah, I know, but everybody, you got to get this. And guess what? Because most fathers have poverty consciousness. Poverty consciousness. I got to go out and make this money. And because they believe that they are not amazing, and because they go to work, they don't live their passion and purpose, they have to go to work. I never want to go to work. And every time I went to work, I got fired. So the reality is I learned really quick, don't go to work, quit your job, find your passion, find your purpose, and guess what? You'll always have enough money. And especially if you find your real true purpose and passion, and then you gift the world with it, then the world will gift you back. That's the way that deal goes.
Mm-hmm.
So anyways,
yeah.
So anyway, so now when your father was saying, "Oh, it's you eating again, Piggy," okay.
Yeah. It was pretty rough to the point where I was closet eating and I went eating around my dad, and then I didn't realize how bad I was impacted. So when I was like 20, I ripped my rectum, considered anal fissure, had to have surgery. And then after I had surgery, I was in the hospital for like a week. They gave me a bunch of pain meds and they didn't mention to me that it was going to make me constipated.
Okay, 1 second. I want you to hold that thought because there's a lot you just gave to everyone. I want to explain things. Now, fever is called a crack. It's a crack in your anus. Now, the reason why you have a fever, it's caused from dehydration. Okay? And first constipation, impaction, and then guess what? So she was dehydrated because everybody thinks they drink enough liquid, but they don't drink enough liquid. But if we would have given Angie, when that happened when she was younger, if we would have given her a warm water enema, structured warm water, because structured water, it's got no surface tension, goes in and cleans better, and we would have mixed a little bit of tummy love or black diamond in with that and did it, we could have sucked up the toxins and got that out. And then if we could have got her to drink like 3 quarts of warm to hot water and to do that, and then daily cleansing tea would be great. If that should everybody should be on daily cleansing tea every morning, every night for the rest of their life, because it's not a laxative, it's not a stimulant. It helps to support all your detox organs, and that's the deal. But nobody knows about this, because what does everybody do is they wait until they're an emergency and then they want to blow it out. And what if you were to create the perfect day every day? You wouldn't have to blow it out. You wouldn't have to become constipated, then impacted. So Angie became dehydrated. Remember, from your mouth to your rectum, it's about 30 feet. So the reality is, if you're not going to drink water and make that into a river, by the time it gets down there, the dehydration causes infection, which causes inflammation, which causes mucus forming. So then it gets really sticky glicky. And if you've eaten sticky glicky foods, it's even going to be worse. Then you're going to be rotting inside. And that's what was happening. Is Angie was actually young, but she was already rotting out her pelvis. And because the water was being reabsorbed from the fecal waste to put back into her body, because she never drank enough water, it left her with these hard rock poo pellets. So when the poo was coming down, it was like a rock. So it was trying to open up the anus wider than it wanted to open, because it was a big rock now that was sitting in the sigmoid point of her colon, the last 8 inches. So it got pacted there, and then she pushed it out, and that's where people will try to push down with their diaphragm, and that's how most people get hiatal hernias. But anyway, so as soon as she ripped her rectum, what are they going to do? They're going to stitch it up. So when you go in and you stitch up that rectum and clean it out, but the stitching up causes, it's surgery. Surgery causes scar tissue. So now after they did the scar tissue, now Angie's rectum is even tighter and more smaller than it was before the surgery, and scar tissue is not elastic, so the chances of her ripping her anus again are like, I put money on that one. So after they do that, and because if they do any type of stitches, okay, if they do any type of surgery, they're going to give you antibiotics. They're going to give you painkillers, which are going to go in and blow up your good bacteria, make them bad bacteria, turn on the yeast in your large intestine to fungus, and then they're called drill bit predators, candida, and then they drill holes through your large intestine. So now you're pooping in your pelvis even more. Take it away, Angie.
Okay, so I had no clue I had ripped my rectum. I just knew whatever happened, it felt like someone was shoving a knife inside of me. And so then that's when the doctor's like, yeah, you have a fissure. So I was in the hospital for like a week, come out, they give me all these pain meds. They don't tell me I could be constipated from the pain meds. So about a week later, I'm standing in the shower and I'm like, my stomach like looks like I'm pregnant. And I've never been pregnant, by the way, but it's a huge, right? And I couldn't pee. I had impacted feces and I had no clue. Couldn't go to the bathroom. So they had to rush me to the emergency room and open me back up and stitch me again.
Can I take a break here? But then you start. Is that okay?
Yeah.
Okay. All right. So anyways, so now how old were you?
Probably like 20.
So guess what? When you can't pee and you're only 20 years old, you're on your way out. As soon as you can't pee and you can't poo, you're on your way out. And you ask anybody who has parents or that are slowly leaving here, they'll say, how's your mother and father's peeing and pooing? Well, it seems to be really slowing down. Well, they're leaving. They're leaving. Now understand something. You can't shut those things off. And remember something, large intestine is the holy grail. It's 85% of your immune system. So you go ahead and kick the shit out of yourself and pile that up in your large intestine. You're going to destroy your life. If you want to take a look out there, you'll find out that 85 to 90% of the population, they're either sticking out like a beach ball or their intestines are falling down and out. Falling down and out. So that's your immune system falling down and out, or that's your immune system blowing up, okay, because you're rotting inside. Well, both of them are rotting, but the large intestine becomes like a dead snake laying down there in the bottom of your pelvis. Now, what happened is the last 3 to 4 inches of your large intestine it comes down like this, sigmoid, rectum, anus. So what happened is the bowel movements got stuck again right here. And what do you think sits right in front of the last 3 inches of the large intestine, where Angie was so impacted again with this big hard fecal ball? Her bladder. So now she's got physical pressure, a rock pushing up against her bladder. Okay, what do you think happens when a big turd just sits there? You absorb that turd, and the longer it stays, the more the water that's sucked out. And remember, the older it is, the more toxic the water. So if it's being sucked out through the large intestine, it's infecting the bladder tissue itself. So now the bladder tissue gets infected. When things get infected, they get inflamed. When they get inflamed, they contract. Now, we already know that Angie has this thing where she absorbs her own waste and poops in her pelvis. So that waste is going to be picked up by the liver and the kidneys. If it's picked up by the kidneys, the actual waste and even E. coli, okay, will be taken up by the bladder. And that's when people say, I have an E. coli bladder infection. Well, where do you think E. coli comes from? You went and pooped in your pelvis. The infection got in your bloodstream, went back through your kidneys, and now it's into your bladder. Your bladder's like a sack. So any fecal waste or anything that it can't deal with will sit in the bottom of the bladder, and it'll irritate and it'll infect it and it'll inflame it. And then the bladder will close down on itself, because that's what happens when you get inflamed. everything closes down on itself. And if it stays inflamed long enough, it'll actually get dehydrated like a piece of beef jerky, like her anus, a piece of beef jerky dried out. So when the poop came through, it re-ripped her open. Okay, Angie, take it away. Thank you.
Well, after I got re-stitched up again, I had to heal from that.
Now she's got triple, quadruple the scar tissue. Now she's got a block of scar tissue and displaced calcium in her anus. I'm telling you right now, she has set herself up for trouble. Okay, fat, creating fat all around her abdomen, on her hips. She has created also, I'd be very surprised if she doesn't have low back problems and osteoporosis and L3, L4, L5, because that's why that surgery is the main surgery on the backs today, is because you're pooping in your pelvis, Elvis, and guess what? And you're rotting out. And when you do that, that infection creates inflammation around the spine. You pull the calcium out of the bones, you dehydrate your discs, you still have all the fiber, and they say, oh, your discs are thinning out. No, they're not. They're just getting dehydrated. We will get anybody that's on their way for low back surgery, and I guarantee you, you're not going to go to low back surgery, because the cartilage will come back, the discs will come back, the bones will come back, the ligaments will come back, the tendons, the muscles, and they don't know what they're talking about. They think that God has forgotten us and that we don't heal anymore, and that's a line of BS. Take it away, Angie.
So after that, I was paranoid to have anything come out of my butt. I lived off probably milk and magnesia for a year, anything. I didn't want anything solid. I had so much scar tissue, I barely could do an enema from Walgreens and get that thing inside me. So I've been living off laxatives pretty much my whole life. I would go to the doctor and he'd be like,
Angie, where do you live now?
I'm in Florida.
Florida. Where in Florida?
Mm-hmm. In Orlando.
Okay, so you know what? We just booked, I'm not going to be back again, but I'll be in Bonita Springs, Florida in October. And if you have any problems, then you can come to Bonita Springs when we do our whole life coach certification, New World practitioner certification, on our pelvic certification. You come down there and I'll work on you, and any bit of scar tissue, we'll do the non-surgical, and I will do that as a gift for you, Angie, and we'll loosen that up and get rid of it, whatever's left. And then if you would, we'll have a cell sonic there. Then we should do a cell sonic to put the electrical impulse back into the mitochondria again, so that they reactivate to make ATP for you. Okay?
Absolutely. Thank you.
You're welcome. It would be my pleasure. And guess what? When I'm doing it, we'll video the whole thing. No, I'm kidding. Okay, go ahead.
So living off laxatives, go to the doctor. He was just like, oh, you need to take castor oil with applesauce. So you need to take aloe vera pills.
You never take castor oil, guys. It's a bad problem. It stays on the outside of the body. Castor oil going on the inside of the body will overheat and cause infection and inflammation. That's the truth.
I can't even bring myself to smell it anymore because I took so much of it. So I can't even get near it. So I've been living off laxatives my whole life.
Can I say something again?
Yeah.
Okay. It's just that you're just so full of information. Everyone, just so you know, that the daily cleansing tea we sell, okay, there's no stimulants, no laxatives. You can take it every morning, every night. And I will tell you that 85% of all your symptoms, which is your body just signaling you and telling you, why don't you love it? Okay, will go away, I promise. And you'll see that weight loss problem, the energy problem, the high blood pressure, the swelling, puffy face. I could keep going. There's just so many symptoms. Now, does everybody understand that Angie took laxatives? And when a laxative goes into the body, okay, you ready for this? It does two things. It actually causes a poisoning of the liver and the large intestine. And the body goes, get this the heck out of here now. So in pushing out the toxin, which is the laxative, you're going to get the looser waste to come out, but you're not going to get the toxins, the glicky, sticky poo that just sits in there and rots. So wrong way to go, wrong way to go. But the only way to go when you know, you don't know how to go. Angie?
Yes. Yeah. So fast forward a couple years later, I went and had what's called laser lipo, these small little teeny tiny incisions, like, right around the bikini area, probably no bigger than my pinky nail, right? Teeny tiny. And they go in there and they take a little laser and they go up in there because I was having fat in my abdomen. Go figure.
You're having what? What were you having?
Fat. I was having accumulation of fat in my abdomen. So.
Oh my God, no. Well, listen, first of all, before you go any further, I hope you know, guys, that the only reason why you get fat is fat has only one thing to do. It's to store inflammation and toxins, heavy metals. That's it. Without the fat, you could stroke out, have a heart attack, or get cancer somewhere. So the fatter you are, the more infected you are, the more inflamed you are. If you want to get rid of the fat, then you want to get rid of the infection in the mind, which means dysfunctional beliefs about yourself, the world. And you want to get, once you do that, then you want to get rid of the low vibrating foods that you've been putting in your mouth. Okay. You want to bring up and have high vibrational foods, because guess what? If you didn't have infection and inflammation, you wouldn't have fat. And that's that. Okay. Go ahead, Angie.
So I had that done. And creating more scar tissue, not even realizing.
That surgery, Angie, creates so many adhesions that will wrap around your small intestine, your large intestine, and choke it off so that you can't digest, you can't assimilate, you can't poo properly. It'll also cause adhesions 3 to 4 inches long that will actually wrap themselves around your ovaries, around your uterus. It'll actually even cut off your fallopian tubes and make you infertile. So guess what? Can I tell you something? I worked on a lady in Texas only 10 days ago, and she had that same surgery. And I had to work on her, Angie. And right just about, let me see, it was about 1.5 inches up from the belly button, 1.5 inches over to the right side. And guess what? They did the same thing, and the adhesion she had, it was a long adhesion, and it went down and it wrapped right around L4. I had to go in with my elbow and actually break this, not break it, but open up this adhesion by working it on the front of her spine. That's how deep I had to go into her abdomen. She calls me up the next day. Okay, I bet she's on here too. I learned so much from that thing. Okay, she calls me up the next day and she goes, Dr. Wolfe? And I go, yes. She goes, I am so depressed. And I said, well, what happened was I worked here, guys, right where her gallbladder is. And she knows if she's on here that I love her, but her husband and her son, which is an adult, they have disrespected her all her life. It's not their fault, but it's the way she was raised, and she realizes that now. And when I went in there, I got rid of all the stored anger that she had in around her gallbladder. It was totally calcified. And then I went in where she got the surgery, and I had to go in really deep. And remember, it's issues in your tissues. How about this? Okay, I'm so sick to my stomach. I feel like I could throw up. You make me so sick. Okay, I can't digest that, you know? Anyways, so she's working on it, and I'll be working on her again when I go back down to Texas. And Rami's working on her now. And Sage is going to work on her. My son, Dr. Sage Wolfe, is going down there. So it would take something like that, about 3 to 5 treatments, and she will have the emotional issues gone, and she'll have the scar tissues gone, and we'll have the calcium back into her bones. Go ahead, Angie.
Okay, so I had that done. I got into heavy bodybuilding. I did 2 shows. I got really lean. I wasn't really having a lot of the scar tissue issues because I hadn't used the fascia blaster yet. So after my competitions, I picked up the fascia blaster. It became like my new addiction. I guess I have like kind of an addictive personality. So
no, like, Angie, can I say something? We all have addictive personalities, just so you know. We just got to pick the right addictions. But the reality is guess what, Angie? You were never good enough for your father. You were never beautiful enough. You were never smart enough. So what you did is the abuse that he gave you, and he wasn't abusing you. He just didn't know how to love you. You just kept it going because you're such a good little girl.
Yeah.
Yeah. There you go.
100%. And I had just gotten out of another toxic relationship, and he was like, you don't need a personal trainer. You just need to eat 2,000 calories a day and lift lots of weight. So after we broke up, I said, you know what? I'm going to get that. I'm going to lift a bar, and it's going to be a healthy bar. It's not going to be drinking. So I got into competing and focused on that. And I focused more on my outside than my mental, right? Not even realizing that it really has to do with your mind to even get your body straight.
You know what? I'm going to tell you something. If you knew how many, trainers and how many people that have been in competitions in bodybuilding are contacting us. I'm not talking about tens, I'm talking about hundreds every week now, okay? Because you know as well as I do, bodybuilders, okay, they look great and they are totally not well.
Oh yeah. So after I did my competition, before the Fascia Blaster happened, my nutrition was, it just, my health declined. My nails weren't growing. My hair was thin. That's when they put me on bioidentical progesterone cream. They said, you're not making progesterone. So I'm like, okay.
And guess what, everyone? When you have to go on progesterone cream, it's only because you're too acidic. If we would have put Angie on Black Diamond, Black Gold, okay, which are the most amazing products, the humic fulvic in the world. And we're the only company in the world that actually make humic fulvic without chemical poisoning. I hope you know that. That's the God's truth. If we would have did that, Angie, and then put you on 1 teaspoon of concentrated humic liquid, I would tell you that in 3 to 6 weeks, you'd be totally balanced. You'd never be out of balance again, okay? Because you can't go and work backwards. And remember something, all hormonal problems have nothing to do with your hormones. It's got to do with the infection that whether it's emotional or physical, it's got to do with the infection that created the inflammation. And the inflammation is actually what throws your hormones out of balance. And the best thing to throw your hormones out of balance is actually emotional stress, whether it's anger, fear, depression, okay, it doesn't matter. Terror, that's the thing. You have to understand the first thing that gets thrown out of whack with stress is hormones. And that's why the medical system and even the natural health system are coming at people from the wrong direction, trying to balance their hormones when all they had to do was put out the fire. All right.
Okay, so they put me on the cream, and they like, oh, your thyroid's low. Great. They put me on thyroid medicine. I'm like, all right. So I've been on cream and thyroid medicine for probably the past 8 years. So I got that going on, and then I picked up the Fascia Blaster.
And all she needed was the infinite iodine. And we'll talk about that in a few minutes. But guys, I want to tell you something. There's only one iodine product that's pure in the whole planet. Not Lugos, not Nascent. Infinite iodine. Go check out our iodine. This is not a sales pitch. We have cancer patients, stage 4 inflammation patients, taking 1.5 ounces of iodine a day because how it puts out the inflammation so well, because it will neutralize a viral infection in only 15 seconds in the body. Go ahead, Angie.
So they put me on that. And then I picked up the Fascia Blaster, and I literally scrubbed my body from head to toe. She had protocols for your face, your nose, your jawline. It changed everything. I don't even look like the same person anymore now that I've stopped blasting. Thank you, Jesus, because I didn't even realize how horrible I was looking. But I am encased with scar tissue in my body from head to toe. My abdomen is so encased so badly, it affects my breathing. I felt like when I was lifting weights after I competed and blasted and got back into working out again, I felt like my belly button was like hiking up. I felt like my calf muscles were stuck and my quads were stuck and my armpits would kind of go like sucked in. Like, I'm like, I would tell my trainer, she's just like, you and your isms, Angie, like, you're fine. You're fine.
Okay, I got to say something. Okay. Can I say something? Oh. Physical trainers are destroying people. I have never met a trainer that I believe knows what they're doing. Okay. The physical trainers at the gyms. Okay. All right. Most of them should be in jail. They should be in health jail. Okay. Because they're taking everyone to hell and they don't know what they're doing. And I just want to say something, everyone. you need to get this. Whether you're talking about finances, you're talking about health, you're talking about love, you're talking about anything on this planet, nobody's doing it right. Okay? These psychos, they have plotted, they have strategized everything. Why aren't we strategizing? Why aren't we coming together as a family, as a nation, and strategizing on how to have the most beautiful life, how to love ourselves and love each other? You know what? They don't even like each other, these psychos, but they'll come together and they'll strategize, and they are taking us down one by one. And understand, and what are you talking about, Dr. Wolfe? Well, I'm talking about that even these trainers, so-called trainers that are supposedly helping people become strong and healthy, they got their head up their butt so far that it would take more than Angie's X-Lax. Okay? All right. Angie?
He was just saying, it's all in your head. You're fine. You know,
of course, because he knows nothing about health. He knows nothing about health. Okay.
It was very frustrating. I know my body. I'm very in tune. I have my massage therapy license. I'm like, this isn't right. This is feeling strange. My belly button is almost like where I was getting a hernia, like where I would eat and like my food would like burp up, right?
Lori, can I get my carrot juice? Would you give me some more? Sorry, Angie. I just wanted to get some carrot juice into me. Okay.
I didn't hear what you said. What did you say?
I'm just getting my partner to bring me over some carrot juice.
Okay. So I've been dealing with that up until now, right? Slamming the laxatives, feeling uncomfortable in a bathing suit, like hiding my body because clothes aren't fitting weird. It almost feels like twisted pantyhose from head to toe. I can just my butt is basically encased and sucked in. The butt cheeks are sucked into the rectum scar tissue, which is coming around into my hips, which is connecting to where I had the laser lipo, which goes up and connects into the belly button with all the adhesions, which wraps around my sides and my lower back, into my shoulders, my arms, down my legs, my quads.
Okay, Angie, you know that you really need some loving Wolfe non-surgical, but the reality is you're going to need 30 to 40 hours to lovingly take all this apart.
I know.
But this is all you tying yourself up in emotional and physical knots.
Yeah. It's all connected. Yeah, I know. But as I've been taking your products, I feel everything kind of getting looser. The scar tissue is kind of, it's like, you know, palpable, and it would be needable to be able to easily break into, which is great, because when I do get a chance to do the non-surgical, it's just going to release, right? It's going to be better, that much more. And I do the belly button therapy. It's crazy how my face gets hot. I get endorphins and I can breathe better afterwards. I have better range of motion. I was in the shower this morning after doing it for like 15 minutes and my lower back like popped twice. So I can actually, you know, put my shoulders back a little better than I can. So it's small, loving steps on a daily basis. And it's you know, it's going to be a journey. It's a process.
You know what? I'm going to tell you, someday I think we all need to get frustrated and angry together and then calm down on how the majority of the population can be paid to poison and to hurt each other. It's so ridiculous. I mean, it's amazing how money has a handle on everyone on this planet. That, you know, I'm going to tell you something right now. I will challenge the whole world to try to see if I have one drop of let me see, how can I say this? Let's just put it this way. I will remain 100% integrity for the rest of my life. And I think everybody should be shooting that and having that as a goal, because it's the only way that we can turn things around on this planet. Okay? And that means integrity to yourself, Angie, that you know that you actually are going to love this woman with all your heart and soul, and observe, because you know what? You're a danger to yourself, right?
Mm-hmm. Yeah. Oh, I didn't mention I have trouble sleeping. I, used to take so much melatonin, probably like 50 or 60 milligrams. Started when I was 15, around the same time that I was having the constipation issue.
Are you doing belly button therapy now?
Yes.
Are you doing belly button therapy before bed?
Yes, I do a little in the morning. I do a little in the little in the evening, and I do the clapping, which wakes me up and gives me endorphins as well. And I've noticed.
Yeah, well, the clapping too. I try to do an hour of clapping before bed. Okay. And I do. I'll do an hour of clapping my neck, my face. Hold on one second. Okay, so tomorrow, everyone, I'm going to come on and I'm going to show you how to clap. Okay. Tomorrow's Sunday. And I'm going to go through clapping and I'm going to go through and show belly button as well. And we'll talk about that. But this is a clapper and this is something we developed and I'll talk about it tomorrow. But I'll actually, Angie, I'll clap my neck right around to the front of my throat, my face, my head, and everyone, just so you know, I clap this hard. How would you like to get rid of all the stress? Did you know that I have done probably this year about 250 consultations for anywhere from young teenagers right up into around their 30s. I do a lot of referrals for suicidal for that group. And one of the biggest things I teach is the clapping, and it saves lives. You know what? Because we get all of this negative issues and we get them, and if we can't address them, we suppress them into our body. And if we can just things come to the surface and let things go. Do you know how many people will actually do the work? They'll come to a whole life coach course, okay? And they've changed their mind, they've changed their personality, they're on a higher vibrational diet, but if they don't go in and do the physical work, okay, to release the issues in the tissues, the junk in the joints, to untie the knots in the body. You know, how many people have said, I've changed, I'm awake, but I still feel crippled? Well, that's because you've got in your body physical blocks of beef jerky, displaced calcium. And we've got to get the calcium back into the bones, and we've got to bring back the life force back into the tissues. That's the only way you're going to get your elasticity back, Angie.
Yes, no, I completely agree.
Yeah. So what else is going on?
So I've been on, like I said, I'm on the products for like 3 weeks now.
3 weeks, that's not long. So what changes?
I mean, there's a lot. Okay, so the first week I stepped on the scale, I was up a pound. And I even took a water pill. And I'm like, what the heck? Again, coming from a competitor mentality and not loving myself, I'm hard on myself.
Yeah, but I explained it to you, didn't I? That the reason why you put on an extra couple pounds is because we went in and we stirred it up. You know, it's like okay, look at that puddle over there. The water's clear. As soon as I step into that puddle and stir up the mud, it's cloudy. I can't see very well, but guess what? So the problem is that Angie's stirring it up, but she didn't take the cork out of the bottle to have the flow, to get rid of the toxins. You know what? How many people will go in and try and stir things up? You don't need to have any, with us, you should not have any healing crisis. None. Go ahead, Angie.
Well, I'm holding a ton of water where all the scar tissue is.
That's right. Well, if I can say this, everyone, everywhere where you have ever had a sports injury, accident, surgery, or you've had chronic inflammation, okay, for a longer period of time, you're going to have scar tissue, whether it's an adhesion in your abdomen, a lesion in your brain, or it's just going to be a knot in your neck. Are you with me yet? Or it's going to be a bunion in your toe. Are you with me yet? Okay, so every time you have any of these blocks, you are blocking the flow. When you block the flow, you will feel stiff, you will feel inflamed, you will have pain, and you will have swelling. Now, Angie has swelling, so everybody's different. Now, once we remove the blocks, no more swelling, the river flows properly. So every time you have a block, you're a damn mess. You're dammed up. So that's why you're a mess. If you stagnate, you're a swamp. If you stagnate and you have blocks, then you're going to have low vibrational tissue, and that welcomes parasites, heavy metals, and infectious material. Okay.
So that's what I'm dealing with. I have what's called a hyper vibe. It's the little vibrating plate that you can, adjust the settings to go really high or really low or
right.
shape. So it's similar to a rebounder. I do that like twice a day. I've been eating really clean, and I just say to myself, there's no way this is that. I can grab it, and if it just shakes and wiggles, it's full of water. It's just fluid. I just have to keep saying with it. It's just fluid. It's going to go away. This too shall pass.
And it is. It's just fluid. And guess what, Angie? If you didn't have the fluid there, you would have more inflammation. Would you rather mutation, or would you rather have the fluid? That because the fluid is actually diluting the toxins, and we know that water puts out a fire.
Yeah. So
okay.
It's very much so. And regardless, you can take a prescription water pill, and you're still going to be more on the scale because it's in your tissues. So.
Oh no! Anybody who takes a water pill, you're looking for kidney problems. So just know that. Okay.
I didn't take one, but I didn't get on the scale this week either because I'm not going to beat myself up. I know it would upset me because I can see it.
Can I say something? Just because we had this come in. Hi, Morgan. Morgan just texted me, everyone. See, Morgan? There she is. And Morgan says, hi, Dr. Wolfe. My name is Morgan. I'm listening to your live with Angie, and I would love to have a live consultation conversation with you. Morgan, you can give me a call on that if you'd like. So feel free to give me a call, or I'll call you, and we'll talk about it. Anybody who wants to get a consultation with me, now understand something. It can't just be, I'm looking to do, okay, here's what I want. Okay, I'm going to tell you something. There's nothing you can't turn around. I'm looking at people that are frustrated, people that are like, I'm at the end of it. This is it. Okay, I'm not going to be doing thousands of consultations. I'm going to be doing consultations on people that chiropractors, naturopaths, medical doctors, they've all given up on you. They've all given up on you. They just don't know what to do with you. Okay, those are the ones. And but feel free to check in with me, and then we'll have a conversation. And like I said, I'm going to be try to do about 4 or 5 a week. These will be going up into my library. Okay, everybody, I have the greatest, most powerful library in the world, self-love, self-care library. If you want to check it out, Doc of Detox. But these will be going in the library under Real People, Real Healing. Okay, and these aren't going to be about what products we can talk about. We will be talking about products and things like that, but we're going to talk about people. We're going to talk about how people need to erase and replace their belief systems. That's the biggest part of it. How if you just totally unconditionally loved yourself, which you don't even know what that means, most of you, and I mean most of you, 999 out of 1,000 don't even know what I'm talking about, and that's okay. There's nothing stupid about you. They've just force-fed you stupid beliefs. What is my phone number? It's 469-861-9454. Understand something. Find your gift and then gift the world. That's what I'm trying to do. I'm hoping I'm successful at it, and I hope everybody believes that I do want to gift them. But that's my phone number, 469-861-9454. Go ahead.
Okay, so I started doing the calcium.
Yep.
I did that, started doing it once a day. So then I upped it to twice a day after I talked to you. You're like, you could probably do it 3 times. So I upped it to twice, and I actually started to urinate on my own a lot more.
Did everybody get that? She started doing ionic calcium therapy, and she started urinating on her own. To understand, guys, ionic calcium therapy is the only calcium therapy in the world. Go to my library and check that out at Ionic Calcium Therapy Guide. And that's the only product you have to call in and buy, because the FDA said if I sell it online, they'll shut me down. Do you know why? That's how powerful this product is. Because if it was toxic at all, they would close me down. Go ahead, sweetie.
I was elated, and I upped it to 3 times. And now I'm in a situation where I'm not peeing as much. So I backed down to twice.
And why do you think that is? And then I'll comment. Let's see if you can hit this one on the head.
It's possible it was too high a vibration for me.
Yes, it is. And guess what? This calcium product is the only one in the world that actually is an ionic calcium product, and it will do over 120,000 hormonal and chemical processes per second. And this is science, guys. This isn't some kind of marketing ploy. So the reality is it's trying to correct too much too quickly. Okay, and we don't have enough flow or circulation to handle the dumping because you have too many physical blocks throughout your body to allow a really good flow yet. Okay.
So it's been 2 days since I did that third time, and I'm still not really going pee that good. I'm holding a ton of water, and it's incredibly frustrating.
Do you have a clapper?
Yes.
Okay, so have you clapped above your pelvis, above the pelvic bone and below the pelvic bone?
I've been clapping like my arms and my legs and my
No. Clap the area because you've got a physical block right in the bladder area. Just clap that area, okay? And are you doing the pelvic squats?
No.
Oh gosh. Well, no wonder. You know what? If you would do the 3 pelvic squats, okay. Now if you go to YouTube, no, it's not on YouTube. Go to DIY, the DIY guide in the library, okay, Angie? And if you go there, you're going to see I just did a brand new video, and it's called Lengthen, Strengthen, Detox, and Tone, where I'm on a purple mat in front of a pool, and I show how to do the pelvic squats and the crab stretch. If you do that and you do clapping, you're going to urinate like a racehorse, okay? All right? Okay.
So yeah, I was just waiting for it to release because it's been 2 days since I did the third margin. So I'm only doing it twice. I also noticed that when I went to floss my teeth, usually I have a hard time. It's like tight. My teeth are real tight, but my gums are feeling so good that the floss just slides in and out like no big deal, no problem.
That's the Merigen. Cool. That's the Merigen now, because what Merigen does, Merigen will actually restore, like even if somebody needed a bone graft, it'll grow the bone back. Merigen will actually restore the jawbone. It'll actually restore and make teeth a lot healthier and tighter eventually. So yours were too tight. But also, Angie, when you do your teeth, you don't have to, but this is how I do mine, okay? Okay, I'm going to answer somebody in a second here. When I do my teeth, everyone, I use what's called silver bullet gel. I put it on my toothbrush. Then I put 2 drops of Healthy Mouth. And then I just sprinkle a little bit of what's called black gold. You'll never have better teeth, better gums in your life. And then understand something, everyone. The plaque on your teeth is actually poo particles from the hot air rotting gas in your bowels. So why don't you go check that out? And gum disease is actually bum disease. Thank you very much. Go ahead, Angie.
Sweet. Okay. So I noticed that I'm trying to think what else. I'm on iodine. I scaled down on 5 micrograms, which is that's a big deal, right? It's for thyroid. So I'm taking 20 sprays of the infinite iodine a day, and then I do 5 of the iodine morning and later on in the afternoon.
How's that feeling?
And good. I mean, it hasn't really been that long for thyroid, I don't think.
I know.
But I'm also in IGF too, so. And when I want like an extra boost of energy, I'll take the Sun, the aminos.
Yeah. What do you think of the IGF 300,000 and the Sun?
Shoot, my skin's never looked so good. It's glowing, and I'm only 3 weeks in. So again, I'm excited. A couple months from now, what's going to be like.
Everybody, if I can say this, I have the only IGF-1 product like this in the world. It's called IGF-1 300,000. I mean that. I'm the only one that has this. If you heard of IGF-1, if you get it from your doctor, it's synthetic. It can actually stimulate cancer cells. If you get our IGF-1, it inhibits them, and it creates healthy cells. But our IGF-1 creates more collagen in the human body than any other product. Oh, here it is right here. Thanks, Lloyd. There it is. This product here is unique to us. And I'm going to tell you right now, if you do this product, IGF-1 300,000, 3 times a day, I want you to call me up and even give a testimonial. Remember when you were in your later teens and you're in your 20s and you could go out and party and be ready by the next day to party again or even make it to work? Well, guess what? I take IGF-1. I do it about 4 or 5 times a day. And understand something, everyone. You can't keep up with me. If you did IGF-1 300,000 3 times a day, every day for the rest of your life, you'll have your youth back. And understand this: when you were younger, you made all the human growth hormone that you ever needed. That went into your liver, and it created IGF-1. And my IGF-1 and the IGF-1 that your liver made when you were younger, if you went into a lab, they wouldn't be able to tell the difference. Did you hear what I just said? They wouldn't be able to tell the difference. And this IGF-1, just let me see, about 8 years ago, Big Pharma came after it, and they shut down the whole sports industry, and they told everyone it was illegal to take this. Meanwhile, it's natural, because Big Pharma got its head in a knot, because this product here, there's nothing else like it to bring back your vitality and your youth. And if you do, if you're a woman and you do 3 SON formula and IGF, if you do IGF just prior to working out, like right before you work out, and then you do 3 SON formula 20 minutes prior before you work out, for that 2 hours, that you will be building more lean muscle, more tone muscle, okay, and balancing your hormones. Go look at the videos on IGF-1 on my website, everyone. Get ready to get your mind blown. If you want your youth back, Angie, how youthful does the IGF-1 and the SON make you feel?
Oh God, amazing. His skin is like super smooth. My mom's like, I don't know what you've been doing. So same thing with the structured water. I think it's a combination of, the structured water, because that goes directly into the cell as opposed to all the other waters out there.
Yeah, Lori, can you bring me the structured water unit so I can show it? Guys, structured water, you can put it under any tap in the world, put any water through it, and when it structures it, you'll have 1,000% better hydration, because there's no surface tension. And it also gets rid of the memory of everybody that drank it, and gets rid of the vibration of anything that's negative, and it cannot harm the body. That's a structured water unit upside down. Okay, that's our structured water unit. Okay, this one's a little older, but you can see them on my website. All right, guys, it'll last forever, and we'll give you a 90-day money-back guarantee. If you don't like it, just send it back. All right. Okay, my phone number is 469-861-9454. When I'm done, I'll put it up on the phone. Okay. Go ahead, Angie.
I take the Amino Boost pre or post workout if I work out that day, or I take it before I go to bed. It's like a little chocolate treat for me. It's something I look forward to. I just take it with structured water and I drink it.
Yeah, we take the Immuno Boost and we mix it with, today we did it with strawberries and oat milk and 2 raw bananas. Okay. Well, I guess that's what they be. And 2 bananas, and we blended it up. I'm telling you guys, you'll love our Amino Boost. It's got all your amino acids in it, but it is, how good tasting is it?
Oh, it's delicious. It's a chocolate treat, like you said.
Yeah, sure. I have it at nighttime. So yeah, I don't do the heavy snacking thing. I do that. That just, okay, Darrell, there you go. Here's your little sweet treat. Okay.
Well, my dessert, it's like frozen bananas blended up in a blender with a little bit of almond milk.
Right.
That's amazing. It's like ice cream. I call it ice cream. In my mind, I'm like, I'm having ice cream, but really, I'm
watch out for the almond milk though, because they're fooling around with it. Guys, I need everyone to understand this. Every company that you're with, where somebody brings out something great, as soon as it gets popular, the tobacco industry that owns all the food corporations now in the world, okay, buy up that organic, beautiful, family-made thing, and they put a twist on it and poison it. So you better check your product, make sure the same company's selling it. And I'm telling you, that's the way the world is. You got to get it. That's the game. You got to be on your, you got to be on the ball. Go ahead.
I'm taking the daily cleansing tea 3 times a day with 3 bags, considering my situation.
Yeah, well, eventually that will change. That will change.
In the beginning.
But I got to say something, Angie. If you did the pelvic squats and you really watched me, go to the DIY guide and we'll talk about it. If you did the pelvic squats and the crab stretch, like I show in that video, and you did it twice a day, you're going to call me in 10 days and go, oh my God, I can't believe the unraveling. So you can either spend more money with me, or you can take this time and just get in there and just breathe it out. Okay.
Okay.
Yeah.
So yeah, I got the cleansing tea 3 times a day. In the very beginning of first week, I was going to the bathroom quite often to the point where I have, of course, hemorrhoids, internal and external.
Yeah, but that's because you're going to have a blowout. You can't back up traffic and not think you're not going to have a blow up. And remember, the more that you stagnate waste, the more that you absorb it into your tissue cells. Now, do you think that poop particles are going to make your tissue stronger, or they're going to make it weaker? And do you think that you're not going to get a swamp called a hemorrhoid? Okay.
So after that, I took the black diamond.
Yep.
I took that. I took a decent amount. Maybe it was too much, but I think it was a blessing in disguise. I got really bloated and really swollen. I felt.
Can I tell them why?
What?
Can I tell them why you got swollen?
Yeah. Mm-hmm.
Okay, everyone. I have a product called Black Diamond. And Black Diamond, can you remember Black Diamond, Black Gold? Diamonds are kind of more precious, so it's a smaller molecule. I also told you that my humic fulvic is the only humic fulvic made in the world without chemicals. Did you get that? You cannot use chemicals on humic fulvic and think you're going to get all the chemicals out. It's impossible. So the reality is that the Black Diamond will go into the brain, into the blood, and into the tissue cells. But are you ready for this, guys? Guess what is the best parasite cleanser, the best fungal cleanser, and the best dewormer on the planet? Right there. And I can prove it. Go in and take a look at the science. It's called Black Diamond Humic Fulvic. And then I have another product called Black Gold. Now the Black Gold, the Black Diamond, you just take 1/8 of a teaspoon. You can mix it with a quart of water. And if it's structured water, you'll absorb it better. So we've already talked about that. Now, if you take the Black Gold and you mix that with your blender drinks, you put it in your soup, or you can even cook with it or bake with it. When you take the Black Gold, which is right there, okay, the Black Gold, it's going to go in and do the same thing from the rectum from the mouth to the rectum. And understand what it does. The Black Diamond, Black Gold will drop off 70 micronutrients to your cells, and it'll grab 300 to 600% of it, 300 to 600 percent of its weight in heavy metals, fungus. Are you ready for this? And worms and worm eggs, and it gets rid of all of it through your blood, throughout your whole body if you do the two. Now, somebody asked about pets. I'm just going to tell you this. When we put the dogs on the Black Diamond, Black Gold, or even the cats, okay, we're talking everything to brain tumors. We're talking about tumors, cysts. We're talking about eczema, psoriasis, arthritis. We're talking about breathing problems. We're talking about hip problems. And just know this, everyone, somebody's asking about a dog again. I will talk about that another time, but we are coming out and we're going to be teaching how you can do non-surgical on your dog. And your dog, let me tell you something right now. Veterinarians are scammers. That's all I'm going to say. There's only one good vet for every 500 veterinarians. They're all druggies. They sell really bad supplements. They sell really bad food, and I don't care what they think, because I love dogs and I love pets and I love children, and all of these are under attack right now. Okay, go ahead, Angie.
So I also keep in mind, I've been doing tummy love twice a day, 2 teaspoons, one in the morning, one in the evening, and I take the 2 smoothies and I do a teaspoon of the gold, right? So
okay, Angie,
do
you see how hard she's going at this? I'm going to tell you something right now. We'll have Angie come back on in 6 weeks if she'll come on, if she will honor us. And guess what? Absolutely. Angie's going to be telling you miracle stories. That's all. So the reality is, if you've got a 20-foot hole and you decide you only can love yourself to build a 5-foot ladder, just because you climb it 4 times doesn't mean you're getting out. And she's going to get out.
Yes, absolutely. Amen. So I took the diamonds, and then that night my stomach swelled. I mean, my clothes didn't fit for 2 days, and just like, this too shall pass. It's okay. And then later on that night, my skin got itchy, like around my wrists, which is really weird. I felt kind of nauseated, sick. And I've been doing the enemas. I have coffee enemas. Occasionally I'll do those. And I did, what did I do? I think I did a tummy love enema where I did the warm structured water with a teaspoon of tummy love.
Yeah, you never want to just do a coffee enema. You want to do an ultimate coffee enema. You know, I just got somebody challenged me and told me that that it's because I wanted to sell product. Well, guess what? Does anybody know how many people have leaky gut, autoimmune disease? We were right now looking at 92 to 96% around North America and Europe. That's right. How high is that? When you do a coffee enema, you're purging your liver of all these toxins. And when you don't use the black gold and the tummy love, then you're not sucking up all these toxins. Guess what? Your leaky gut, it goes right back into your bloodstream, and now you're going to cause havoc. Go ahead, Angie.
So that night, I felt like I have a fit wrap. I have like the kind that you have in the spa, like the real expensive one. I put that in my house a couple of years ago, like when I was doing my competitions.
You put what in your house?
Infrared sauna.
Oh, an infrared sauna. Good. Yeah. Great.
So I got that. So I even did a sauna that night, right? So I must have heated everything up. And I thought I had gas. And I went to the bathroom and nothing came out but air. And I looked in the toilet and there was a bug in there, really long one. I was, oh my God. I had no clue. I wasn't even trying to get rid of these. I didn't even know I had them.
Okay, well, 99 out of 100 people have infestation of worms, and the whole world is full of worms because take a look at the world. How many people know that right now 85% of the population is pre-diabetic? How many people know that, I just said it, up to about 92% of the population has an autoimmune disease? That's only 8 people out of 100 that don't yet or been diagnosed, guys. Okay, so understand this. Itchy anus, okay? Where the whites of the eyes are kind of having a blue-gray color, okay? All right? Okay, so also at night when you're sleeping, you drool a little bit, okay? Or always scratching and itching your skin. How about TMJ problems? Now, it doesn't mean if you have a TMJ problem that you have worms, but you know, when you look at the clues, and everyone, when you get a perfect day consult from us, you'll be getting, if you come to get one, it's $150. You'll be getting a manual, a 400-page manual that shows you everything, how to diagnose and assess yourself and what actions to take so that you don't have to become a reaction and run to the hospital. Because understand this, you should only be going to the hospital if you truly were an emergency, okay? Go ahead, Angie. So Angie's getting rid of worms, everyone. What do you think of that?
So the next morning, same thing.
I told you the black diamond and the black gold gets rid of worms. It'll get rid, the black diamond will get rid of worms out of your brain, out of your cells. Do you understand, everyone? And understand this, everyone, if you don't mind, Angie, I just want to say this. Guys, just stop it. Stop it. You know what? What if you were to create the perfect day today and you repeat it every day? Well, you'd never be sick. Why do you have this idea like the medical system? You wait until you feel like crap or you feel so wormy that you want to go and do a worm cleanse. And most of you will go and do a herbal worm cleanse, but you didn't bring up the vibration of your tissues. And then guess what? You're always going to keep having issues in your tissues until you bring the vibration up on an emotional and physical level like Angie's doing. Go ahead, love.
So I passed another one the next morning. Again, another really long one. And I was just like, oh my God, this is wild. And then that's when I talked to you. I'm like, Doc, this is what's been going on. And you're kind of like, all right, well, let's talk about this. So, also, I take your magnesium. I love the magnesium. It really does relax me. And I'm taking less sleeping pills.
Can I explain to them?
A blessing. Go ahead.
We have a product called Mag Infusion, everyone. It's best taken where you take, just take like 1/8 of a teaspoon. You put it under your tongue. It'll heat up and it feels metallic, but it'll absorb right into your bloodstream. And understand, anybody hear of a product called Calm? Well, that'll give you a laxative effect. You don't want laxative magnesium. Magnesium should always be absorbed through the mouth or through the stomach. Our Mag Infusion, they did a study and they did over 50 different magnesiums. And this magnesium will infuse itself right into your cells, and that's where you want it. We tell people who are really stressed out to do the belly button therapy And after they do the belly button therapy, to put a drop of frankincense in their belly button, and then a drop of CBD in their belly button to actually stimulate 50,000 nerve endings in your body for healing. But we also tell them to, after they do that, before they go to bed, to make sure they do a scoop under their tongue a half an hour before bed, and then just as they get into bed, do another little scoop under the tongue, 1/8 of a teaspoon, and then belly button therapy. Connect to your Lionheart breath, put a slight smile on, and just say, thank you, dear Creator, for everything you gave me today. Thanks for working for me. And I am blessed, and I am patient, and I will become my own practitioner. Say whatever you want, but just know this. Know that that which created the whole universe loves you. Okay. Angie?
So yeah, the magnesium, it's great. I've taken, someone who can't go to the bathroom my whole life, I've taken so many different kinds, the Calm, you name it, the glycinate, there's so many different types of magnesium, but this one definitely relaxes your entire body, and you literally will find yourself falling asleep into slumber, which is a beautiful thing.
They will. That's why it's called Mag Infusion, because it infuses. Now, I'm going to ask you a question, Angie. Have you done any vaginal infusion yet?
No, actually, I just ordered the Silver Bullet gel and the other things to do the vaginal infusion.
All right. If anybody,
it's on its way here, so.
If any of you women want to know how to get your nutrition 1,000% stronger than taking it orally, it's called vaginal infusion. And if you want to know about that, go into the DIY guide in my library, and guess what? Totally unleash the power to roar. Okay? All right.
Also, my mom, she's got a lot of inflammation and swelling. She does have victim mentality, coming from like a past of her father sexually abused her, and she never really released that and let it go. She, about 2 years ago, had the gate at the office fall on her to where she cracked her sacrum in 2 different places. Now I can see that the swelling and all of that, the adhesions, so I've been working on her and also kind of incorporating the calcium, and she's starting to feel a lot better from taking the calcium.
So healing now is becoming logical. And when you hear something now, it's not like, wow, this is just beyond my train of thought. I just want everybody to know this, that there's hardly a medical doctor that even knows anything about health. They are the most illogical practitioners I've ever heard in my life. I want nothing to do with them. Absolutely nothing, unless I'm in a sports injury or car accident, which I probably will never be, because I love myself so much. I know that I'm protected that way, but the reality is the medical system is not broken. Okay. So don't be trying to fix it, because they're not going to fix you.
So I put her on that. So she's been taking that, and this is the best her blood pressure's ever been in her life. She's always had really, really high blood pressure. She's doing the Black Gold twice a day, and she does Tummy Love, and that's it. And she's got excellent blood pressure. So I'm kind of like doing baby steps with her. I did a little bit of belly button on her, and then that's when she started to feel like she went on a trip and she felt sick. And then that's what I was told. If you have victim mentality, your body is going to take it as you're harming yourself.
That's right.
We're not doing that anymore. It's really small baby steps for her.
Yeah.
Really,
you know what, everyone, if you are courageous, if you are a Braveheart hero, don't think that other people are like that. Okay. I want you to go and mind your own business, or just put a little breadcrumb out. Okay. Because people are not stupid. They're not ignorant. The problem is that the subconscious says anything that's too different, or if you give me too much, I'll push back on it, because the subconscious, 90% of the brain, that's what it is. 90% of the brain says, guess what? It's my way or the highway. I don't care if this is a prominent, dominant belief. Even if it's killing you, we're going to do it anyway. That's the truth. Okay. So be very gentle. It's better to mind your own business, Angie, and just become what you've been preaching about, right?
Yeah. Mm-hmm. I agree completely. So my question is about parasites. How long do they stay in your system? I have no clue how long this thing was inside of me. Do I have more?
Do you think that someday that you could vibrate higher than a worm?
Yes.
There's your answer. And nobody wants to hear it. What are you, like, ridiculous? No, I'm not. I could eat worms. I could eat eggs. They're not going to vibrate in me, Angie. I already know that. Okay. I already know that. And you'll know that eventually. You'll know that until you want to unconditionally love yourself, Angie, just have lots of conditions. Have conditional love for yourself, Angie, and you've got worms. Have conditional love for the world. You're going to have worms. You have to vibrate high for something lower to leave. That's how it is. You know, depressed people, angry people, okay, frustrated people, they all have worms. That's it. That's it. The invisible becomes the physical. The psychological rules the biological. Okay, so that's it right there.
How long do they live inside you for, though? How long can they?
Oh God, for the rest of your life. And then when you pass on, you'll be gone, but they'll be in your carcass still. Because okay, wait a minute. Why do we get worms, Angie? Because we're rotten.
Right.
Mm-hmm. We're rotten, man. We're rotten. Yeah. Now, how many people are rotten here first? Okay. Stinking thinking. Okay. Stinking drinking. Okay. Eating instead of nourishing. Okay. All right. Okay. And then doing things that are low vibrational. Think about it, Angie. How much did you love yourself, Angie? You didn't even love yourself. You know what? What would be, I'm trying to think of the word that you had for you. You were disgusted with yourself. Now, the only time that I would be disgusted with something is if I saw that it was, oh my God, that's so disgusting. That's a manure pile full of worms.
Yeah.
So if you're disgusted with yourself, what should you have, Angie?
Yeah, worms.
Thank you.
Okay, so I'm just going to continue on, and like with the process of what I'm doing, is what I meant. And then my other question is, how long are these tissues going to stay so heavy with water? So you're saying once I start to exercise.
Okay, so here's the deal, right? So no matter what kind of block we have, until something gives away, nothing else will give away, right? What are you willing to let go on an emotional and physical level today? Okay. You know, believe it or not, Angie, somebody that is a hoarder in their house also is constipated. Are you with me? Mm-hmm. All right. Somebody who cannot let go and forgive, would they be constipated, Angie? They wouldn't be all the time, because guess what? They're going to end up with diarrhea, because their body's going to want to blow that stuff out, because diarrhea is just a symptom of a constipated person. Did you know that?
Makes sense.
Okay, thank you. And understand, Angie, can I ask you another question? Have you ever done any therapeutic vomiting yet?
No.
Okay, well, the next time that you feel really nauseous in your stomach, look up therapeutic vomiting in my DIY guide, and do structured warm water therapeutic vomiting. And I'm going to tell you something, you'll get rid of a lot of your blocks in your body, because believe it or not, when we do therapeutic vomiting, we get rid of the emotional and the physical contamination. I've got people that have had cancer, people with migraines, people that could not digest, people that had pain throughout their whole body, people with immune disorders. And what we say is that if we start cleansing, we start moving along. When you feel nauseous, I could take the time. Well, tomorrow, I don't know, maybe tomorrow I'll talk about it, because we'll be here too long. I'll tell you what, anybody wants to watch tomorrow, I'll talk about therapeutic vomiting, clapping, and belly button. That's like a whole show. But anyways, take a look at the DIY guide. And Angie, you've got this. Please, you go in and do the therapeutic vomiting like I lay it out, and you're going to call me up and go, oh my God, you have no idea how my ankle feels right now. Yeah, people will do therapeutic vomiting and they had something wrong with their ankle and it's not there anymore. See?
The fiber clear is breaking the adhesion so much where I can literally grab like a chunk of it.
Yeah, well, that's it. Well, the fiber clear, everybody, is a systemic enzyme. and it goes in and it eats up scar tissue. It eats up trapped protein particles. It eats up the garbage in the body that's not. It'll eat up tumors. I can tell you something. I had a gentleman just for talk's sake here, and I had him doing 250 fiber clear a day, Angie. 250 a day. He had a tumor in his bowel, so he was blocked, and they said they were going to have to remove his large intestine because it was so blocked because of it. And it took us 6 weeks. He had to do warm water enemas every day just to get a little bit out, because you cannot block that stuff up. It'll kill you. But he was doing 225 to 250 fiber clear a day, and then doing the non-surgical work. And then he was doing some other things like he was actually doing the vaginal infusion rectally. So we were doing a lot of work with him because nobody wants to lose their colon. So the reality is it took us 6 weeks and the block broke. And then it took us 3 months. It was almost 3 months and the tumor was completely gone. Okay.
Amazing.
Yeah.
Oh, well, I mean, that's my story. And for the record, I don't work for Doc at all. I just ran across him on TikTok and I thought he was speaking truth, and I listened more and more. And I was interested in getting rid of the inflammation and going to the bathroom. That's where this whole journey started.
And understand something. It's all about peeing and pooing, right, guys? It really is. Every bowel movement is a computer printout, and you should be having 3 good bowel movements a day. And the reality is, everyone, go watch my How to Become Number One at the Art of Number Two. It's free. It's a masterclass in my library. Go check that out and get a real training. And also, far as the scar tissue goes, did you watched Reverse the Irreversible, right, Angie?
No, I haven't watched that one yet.
Well, go watch Reverse the Irreversible, and you're going to find out why you have all the scar tissue and how to get rid of it. Okay, it's in my library. Okay. All right. Somebody is asking here: is silver bullet spray the same as silver gel? No, silver gel is a gel, and it can be taken orally. It can be put in the ear for tinnitus. It can be put in the vagina for vaginal infusion. It can be swallowed. It can be used on the skin for eczema and psoriasis. Tomorrow, I'll show how to work this with different skin conditions and why we would use the silver gel, a little bit of C60 and a little bit of frankincense. So, you know what? We're just going to keep on doing these shows. These shows are called Real People, Real Healing. And they're going to be going into the DIY guide, all that in my library. Angie, is there anything you'd like to say?
I'm a believer in your products. I'm the type of person, when I go all in, I'm all in. And that's why I can say he didn't tell me to buy any of this stuff. I did it all on my own, based off my own research. And I'm blessed to have found you. And again, I'm really excited to see where I'm being a couple months from now.
How about you come on in 6 weeks? Okay.
Okay. No problem.
6 weeks from now. Would you like that?
Absolutely. Yeah.
Hey, bring Mom on too.
Okay.
Okay.
Mm-hmm.
Okay, let's do it. Angie, thank you.
My pleasure.
Bless you.
Thank you. Bless you too.
Bye, love.
All right. Bye-bye.
All right, that's Real People and Real Healing. And you're never going to get healed unless you say and do what you need to. And that's totally unconditionally. Love yourself first and foremost, or you'll never be able to do it for anyone else. And you can say, I've already done it for other people, and I'll tell you haven't, because it won't last. When you've rocked it with loving and caring for yourself, and you never have to think about doing it again, because it is first nature, second nature, third nature. It is natural. Okay, it is natural to totally unconditionally love yourself. Please go and take a look at my Braveheart 12 Loving Steps. And if you really want to get this game on, go in to my library at the Braveheart 12 Loving Steps and learn how to do mirror work. Okay, get yourself a love band, life band. 3, 2, 1, I got this. This is a kiss. Hear it? That's a snug as a hug, because I love this guy. Do you love that guy? Do you love that girl? Well, you better, because guess what? You're going to be with yourself forever. You should be your best friend, okay? And there's never an end, okay? Remember something. You are an infinite spirit being, everyone. And I'll be back here again tomorrow. And like I said, I'm going to be on with Jim Gale. And we're going to be doing a weekly show at 3 o'clock Mondays for only 15-20 minutes. And we're going to be talking about how he is turning all the yards that people want into gardens around the world, and how he is going to teach you how to hack your gardening to get more out of it so that you can stop eating and start nourishing. Wouldn't that be something beautiful? And guess what? I'm going to be on here with Peter Temple. You may not know him, but you're never going to forget him. We're going to be on at 9 o'clock Eastern Standard Time. Okay, am I right? Yeah, 9 o'clock Eastern Standard Time on Monday night. And he's going to tell you what's going down. There will be more going down and more changes financially, okay, and health-wise, okay, and planet-wise in the next 3 years. And guess what? Let's just take a big, deep breath, okay, and come and watch the show and come on and ask questions, all right? And like I said, I won't get you to you today, but I'll try tomorrow. Just text me at 469-861-9454 if you would like to maybe come on and do a live real people, real healing show with me. And I don't know, you know what? I'm going to tell you something. I didn't perfect it yet. I'm not going to lie to you, but I want to make sure before I leave this planet that I love everyone. You have a beautiful day. God bless.